Well, the time is just gone 20 minutes to 9 as we continue with news and views this morning right here on Asala Media. And we are now focusing on the PEPFAR program. And we are talking here about the United States of America, the decision by the government to temporarily freeze funding to the president's emergency plan for AIDS relief. And also, this comes alongside all other foreign aid for at least 90 days coming into immediate effect. And clearly, there are concerns. Doctors Without Borders, MSF, have raised their concerns. And this is the reason why we are now joined by MSF's Tom Ellman. Tom, good morning to you and welcome to the show.
Morning. Thanks for having me.
Yes, obviously we are living in very, very interesting times, but also uncertain times at this point in time. And it is clear that this uncertainty surrounding the PEPFAR program is of major concern. It is putting millions of people at risk. And just looking at this decision by the United States government to temporarily freeze funding to this emergency plan for AIDS relief, Tom.
Yeah, well, what we're seeing in the programs we have across Africa, in Zimbabwe, in Sudan, in Congo, in South Africa, almost everywhere we work, talking to our partners and to the communities, we're seeing really devastating impact, particularly on people living with HIV or at risk of HIV. A huge amount of distress and confusion as people have turned up to find that the clinics that they would normally go to had their doors closed and they didn't know where to go. Literally overnight, from one day to the next, people on treatment, taking these drugs that need to be taken every day to keep you safe, were unaware of where to get their treatment. And so people were coming to us, asking what was happening. And the impact is huge. Over 20 million people rely on PEPFAR for their antiretroviral drugs. And without those drugs, even short interruptions of treatment lead to a risk of resistance developing, meaning that drugs won't work anymore, and worsening impact of the HIV, ultimately leading to AIDS and potentially to death. So this is a really dangerous development, and we need these people to have guaranteed access back to their treatment as soon as possible.
Yes. Tom, what do we know about this freeze in funding? Is this permanent or is this temporary? And I know there is a lot of confusion and uncertainty whether this critical lifeline has been cut off totally.
We don't know. The simple answer, we really don't know, and nor do the patients and communities. And people are very worried. People are scared. At the moment, all we know is that there is this 90-day freeze. We also have recently heard about waivers, and we have seen with some delay that some clinics may be starting to reopen. But the amount of confusion in itself is causing damage to people's health, their physical and mental well-being. And in the long term, if the funding is not renewed, is not guaranteed, it leaves an absolutely massive gap that cannot be filled in the short term, which will lead to millions of lives being at risk.
Yes, and the mere fact that HIV/AIDS hasn't gone away, and after all these years, and also with all the treatment that is taking place at this point in time, it still remains a critical area that particularly us in Africa and on the continent need to focus on. And this is the reason why this lifeline is so crucial, Tom.
Absolutely. So we have no cure for AIDS. We're still looking, and if research can continue, hopefully one day we will. Until then, people need to take a drug every day to treat HIV. And on top of that, the tragedy is we're really moving forward. We've recently found some amazing new opportunities to prevent HIV, preventive treatment for people at high risk called PrEP. And even that is being made inaccessible. And people most in need, the most vulnerable people at greatest risk of HIV, are seeing their access to those preventive treatments blocked as well. So that speaks to the future, and people stopping treatment will inevitably lead to greater transmission of HIV and set us back decades in the fight to eventually eliminate HIV as a public health problem.
Well, Tom, this was going to be my question in terms of transmission and the risks of further transmission. And we know that at this point in time, we are already witnessing, as you pointed out, that there is an impact on patients. Looking at us, particularly also, on the southern tip of Africa, the sub-Saharan. We know what's happening in Zimbabwe, Mozambique as well, and South Africa as well. So at this point in time, the risks are huge. It's massive. It's great.
Absolutely. Every day that somebody is denied access to their antiretroviral treatment, the virus starts to rise. And that means that they have an increased risk of getting sick, an increased risk of getting resistant, and perhaps most importantly, in terms of AIDS making a return, an increased risk of passing HIV onto their partners, their loved ones, a pregnant woman passing it on to her child. So we desperately need these drugs to be made available immediately. Luckily for us as MSF, we're not dependent. We don't take any funding from the US government, and our independence allows us to carry on. But this is a gap we cannot fill. This is a gap no one can fill. We need everybody to step up and do their best to fill this gap. But most importantly, we need the tap to be switched back on. We need that money and those drugs to start flowing again, and to remove this threat that is creating so much distress and confusion.
Tom, at this point in time, is there a plan B? Is there an alternative?
Well, I can't really speak to the alternatives. Everyone needs to do their best. We have always called for all parties, for all donors, for all governments to put more into the fight against HIV and indeed into healthcare in general. That's the best we can ask for. But what's very, very clear is that a sudden stop in funding from the biggest source of funding globally for humanitarian aid, for HIV, for health in general, a sudden stop in that cannot be filled.
Tom, just in your experience and just looking across the continent as well, and apart from this freeze with regard to the medication that is required, what is important to understand is also the testing process, and just to understand after all these years. And on the continent in general, do people really know what their HIV status is? Because I'm sure this freeze in funding will impact on testing as well. And if people don't know their HIV status, the situation could actually reach horrific proportions if people don't know. They have no knowledge.
Yeah, no, that's absolutely right. And this freeze is affecting all aspects of prevention, care, and treatment for HIV. It's denying access to crucial support for community groups who are absolutely critical in passing on information, in fighting stigma. Stigma, unfortunately, remains a massive barrier for people testing against HIV. And the supply of these commodities, of these HIV tests, is currently unavailable to some people because of the freeze. So no question that battle to ensure people are aware of their status. Just as an example, our programs in South Sudan, which is heavily dependent on PEPFAR funding, have been disrupted. South Sudan, even now, only 50% of people with HIV are aware of their status. And that means that there are many, many more people needing access to testing in order to discover it. Pushing for that is set back hugely by the blocking the flow of tests, blocking the flow of support to communities that are encouraging testing. I think I lost you briefly.
Hear me now.
Sorry.
I think we just lost each other. I just want to refer you to a statement that you've made where you speak about when MSF first started treating people with HIV/AIDS in South Africa 25 years ago. There was no medication on the shelves, and every diagnosis actually felt like a death sentence. And again, I suppose if we're going this route with the freeze of funding, that death sentence that you actually speak about, we could be revisiting this 25 years later.
Yeah, it's unthinkable. I don't even dare think about that. HIV was an absolute death sentence for anybody with the disease until the drugs appeared, until we were able to access them. And those people who have been on treatment all these years rely totally on that treatment. So if the drugs disappear, HIV becomes a death sentence again. And that cannot be allowed to happen.
Yes, the question now is, we're talking about a 90-day freeze, and will the U.S. government resume funding? Just how confident are we? Are we optimistic that we're going to get back to where we should be at this point in time, Tom, with regard to HIV/AIDS and the PEPFAR funding?
Well, I can only speak to what we're seeing in the field, and I leave it to others to push the envelope on how this is resolved. What we can see right now is that there are people who are at risk of losing hope, and we need to put it back. Those drugs need to start again. Treatment needs to be available. And that's all we're asking for.
Well, Tom, let's leave it at that. Hopefully, the matter should be resolved, and so that you can get back on track. MSF can get back on track as well. But for now, we thank you for taking time out and unpacking this with us right here on Salam Media this morning. All the best to you.
Thanks very much. Thank you.
Director of MSF, Tom Ellman, was us this morning. And with that, we're going to go for a quick break. We come back. It's going to be Chuba Inspirations.